I began to recognize that I was having problems in accounting for what I was saying and what I needed to say. I went to my doctor, and my doctor said, well, there's a condition that comes on when you reach about your age.
Within the year, he diagnosed him with Alzheimer's disease.
4 or 5 years ago, we started to do something called an early stage forum for people with dementia. And after that, the floodgates just opened, and more people with dementia wanted access to more programming, and we didn't have anything in place.
We have an aging population, so we're only going to have more people being diagnosed with dementia. We need more support.
There was really nothing for them until they had progressed to the moderate to late stages of dementia, where there are some day programs.
To be able to partner with Capital Health and to partner with Dr. Veronica Hutchings to deliver more services for people with early stage dementia, we're like, wow, this is something that we can really do and do well.
I had the history of several people in my family who had that disease, and at that time there was nothing. There was nothing. And now suddenly there was this new program. I went there eagerly thinking, this is maybe going to be the beginning of some help for my husband.
Alzheimer's is not something that you can handle alone. You really need a group, because they can offer so much, and you can figure out that life is not going downhill as fast as you thought. In fact, I often think sometimes I got more inspired when I got Alzheimer's than I did when I was flying missions in combat, if you want to know the honest truth.
That's what I think these groups are doing. They're giving those individuals with dementia an opportunity to communicate and to connect.
It's a safe place, you know, because when Jack has to face the world, some people are not kind, and, you know, they put him in a box.
When somebody pauses, you know, we don't jump in, we don't cut them off, because we know that they're just taking the time to find the words.
And when he comes home, I see a real change in him. He's happy, he's full of hope.
You come out of each one of the sessions feeling like, hey man, this world is not so bad, you know? And believe it or not, I'm coping pretty darn good.
Working in partnership with Capital Health and with Veronica Hutchings enables us to do a lot more than we were ever able to do before.
This is kind of the first time that we've had kind of truly joint initiative programming.
I think that linkage between the QE2 and throughout Nova Scotia, all the hospitals and the society is very, very good, beneficial to both, and most especially to the people like my husband and myself.
We both feel the sense that, man, if we didn't had this, what else would there have been that would have given us the same sense of achievement, ambition, and success?